The reality is that erectile dysfunction is multifactorial, right? So you have an organic cause of erectile dysfunction, which is probably the most common for whatever reason, and there's all these different types of reasons that could cause this. You just can't get the blood flow to your genitals, just isn't enough, right? So, I mean, an erection comes from literally just blood shunting into your genital areas. Some can get an erection and they lose it even during intercourse. So there's different versions of erectile dysfunction. My main philosophy is every patient who comes in with erectile dysfunction, they definitely need to have their hormones checked. Because if you don't have enough testosterone, you're going to have erectile dysfunction. But at the same time, some patients can be on testosterone therapy and still have erectile dysfunction, right? So in other words, this is a patient that we have on testosterone. We know we have healthy testosterone levels for him. He's feeling great, but he still has erectile dysfunction. Then we can say, hey, you know what? Maybe it's more, instead of a libido cause, instead of a libido source of it being from lower testosterone levels, it can be more of a blood flow reason, right? And maybe the patient has a history of high blood pressure. Maybe the patient has a history of diabetes, right? All those things can cause damage to those tiny arteries that go to the penis and can cause erectile dysfunction. That's where the PDE5 inhibitors like sildenafil and tadalafil come into play, because those medications, what they do is they increase blood flow down there. So if a patient has an organic cause, a physical cause to have erectile dysfunction, that's when we recommend those medications. But I think for all those patients, if any patient comes into our clinic and says, I'm having erectile dysfunction, checking those testosterone levels first is definitely the way to go.